Hello everyone, welcome back to my channel. For those of you who are new here, my name is Beck and I am a third year nursing student in Western Australia. For those of you who aren't new, welcome back. Hello, how are we all? Today I'm going to be doing a video all about my paediatric placement experience. I've just come off doing 3 weeks at a small paediatric unit in one of the hospitals and I really enjoyed it, so I want to talk to you guys all about it, what like a normal day consisted of and what to expect from paediatric placement. And I'm also going to be doing like a Q&A at the end of all the questions you've asked me on my Instagram and questions that have been sent through to me so I can answer those. So I wrote a little list. I'm going to go through it quite quickly because I don't want this to be a long video and I want to get to the main like Q&A kind of stuff because that was like the most exciting. So I was on a paediatric ward, obviously. It was a locked paediatric ward, but it was only in like a general hospital. I was only in an 8-bed ward, so it was quite small. We had a RMO on at all times in the nurses station, so only an 8-bed ward and you've got a doctor there all the time, which was crazy because I've been on wards that have been like 23-bed wards and you don't have a doctor there all the time. Okay, so first of all, there was a few things that I wanted to kind of like run over about what's different to a paediatric placement to adults. Like obviously you're dealing with kids, so there's just a few different things that are, I don't know, different. Probably the biggest one is medication. With kids it's all per kilo, so you have a dose, it'll be like 10 milligrams per kilo. So instead of just being like 10 milligrams for your normal adult or whatever, it's like it goes off their weight. And you've also got to double check everything because they're kids and they're so much more susceptible to overdose and anything like that. So it's a lot more antic with that sort of stuff. I wanted to mention like with pediatrics there's no schedule, so I think that was the main difference for me. On a normal like adult ward, you go in there 7 o'clock, you get handover, straight away you're doing bed baths, showers, making beds, getting people up for breakfast and stuff like that. And with pediatrics you're not doing that. Like, kids are on their own time. Like, you can't stress that enough. It's a lot more cruisy, like it's less bam, 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 like 8 o'clock meds, 12 o'clock meds, 8 o'clock obs, 12 o'clock obs. It's nothing like that. There's absolutely no schedule. So you can't really plan it. It's just, it's all dependent on when your kids wake up, what your kids are doing, if the kids are happy, if the kids have got a temperature. Another thing that I like didn't realize was, obviously it occurred to me, but it didn't like properly occur to me. Like I didn't go in there, it was just like, oh yeah. But then when I got there I was like, oh my gosh, like the mum or the dad, they stay with the kids overnight. So overnight, or even during the day, you've always got a parent there or a boarder is what they call them. So like a carer or anyone who's responsible for the child basically. So they're always there. So that's kind of who you're dealing with when you're going in and doing obs and you've got like a difficult child. They're always there. So it's a lot more helpful in that sense. Like I was terrified before going because I was like, what if the kids hate me and I can't take their obs, stuff like that. But yeah, it was good because the parents are always there and they help you because they know their kid. So probably the main component of the pediatric placement that I wasn't expecting was a lot of the time you're holding the kid down and like that's your main responsibility. I mean, like if you're doing an injection, doing a nasogastric tube, doing a cannula, taking blood, only the doctors or the pediatricians can take the kid's blood. So you literally lay them in a treatment room, you take them away from their parents if they don't, like, because a lot of the parents don't want to see their child being pinned down and stabbed in the arm for blood. Reasonable. So you take them into the room and you lay them on the bed and you get like a sheet and you wrap them like a baby, like a 2-year-old. You're wrapping a 2-year-old up effectively and holding them down. Like you literally, it's just in there holding this kid down. With toddlers and stuff like that, you don't use a tourniquet when you're taking their blood. So I was literally holding the child like this and effectively being the doctor's tourniquet. And he's like, all right, now release the pressure and put your finger here on the vein, because he had the cannula at this stage. He's like, but he hadn't closed it off or whatever you call it. So he's like, put your finger there, and I like had to hold down the blood from pouring out. So I was like the valve, and he's like taking blood from the cannula, and then he's like, all right, now let go. And I'd let go and he'd take more blood, and he's like, now pressure, and I put pressure on. Like it was really cool because if I'd let go, you know, that kid would have bled everywhere. Another thing that I thought was interesting was like you're kind of mother crafting some of the time. So we had parents and babies in that they weren't necessarily sick enough to be in hospital, but the mums weren't coping, so it's called acopia. And so one of the days I pretty much spent helping this mum know when to feed, know when to force the baby to wake up to feed, helping her breastfeed and helping her transition to formula because her milk hadn't come through yet and the baby was losing weight. I was like in there when the midwife came in and kind of went over some like teaching methods and how to breastfeed properly. So it was weird as a 22-year-old who hasn't had a baby to be helping this mum learn how to look after her baby. Like, it was quite special. One more thing that I wanted to touch on before I do like the Q&A aspect is you are dealing with kids. Some of them absolutely hate you. They just hate being touched by a random, and it's fine because you expect it. I mean, you don't randomly go up to a kid anywhere and just randomly start putting things on them and doing their obs and like stuff like that. So it must be quite strange for them to have that happen to them. So you've got to really be able to be enthusiastic, and I actually really enjoyed that aspect of things because I was able to bring bubbles, I was able to dance and sing and play peekaboo, and I'm not usually a big kid person, but this placement kind of made me more of a kid person. Like, I really enjoyed it. Like, it was just so fun to be able to be a dork and it to be good. So that was the parts that I really enjoyed, and like what I kind of got from the whole placement experience. So that's my little 2 cents worth, and then now I'll move on to the Q&A part. So first question, what are the majority of the illnesses? So the majority of the illnesses you see are bronchiolitis, asthma, pneumonia, we saw some UTIs, polynephritis, which is infection of the kidney from a urinary tract infection that was untreated. We also saw lots of flus, like babies. The only reason they were in there is because babies are nose breathers and they can't breathe through their mouth yet. So when their nose gets a little bit congested, they can't breathe. So a lot of the times we were putting apnea monitors on those babies. So they would have a monitor on their stomach, and if they stopped breathing for more than 20 seconds, it would go off and you'd run. So that's kind of the majority of the stuff you're seeing. You're obviously seeing minor surgeries as well, so like tonsillectomies, and you have a lot of abdo pain patients come in. That's more of like your older patients, and they come in with abdo pain, and that'll be like query gallstones or stuff like that. So that was also one of the common ones. They would do ward reviews, so there was a few babies that had anemia, a few different chronic illnesses that came in that they were just being treated for, so that was also quite interesting. So yeah, I hope that answers that question. Next question is, how old is your oldest patient? The oldest patient that was accepted to the ward is 16. So anyone above 16 is taken to an adults ward. Biggest difference to caring from adults? Oh, this one's a tough one because like there was a lot, but like I was saying before with the schedule thing, that's probably the biggest difference that I noticed, was the fact that you can't just wake someone up and be like, it's morning time. Like, they're kids, they sleep, they do what they want. Like, they're so unpredictable and they're so just chill. The other biggest difference would probably be your vital signs take so much longer when you're doing it on a kid. If they're a bit older, like if they're like 12 or above, whatever, that's fine. You can kind of get in and out quite quickly. But with your babies, with your toddlers, you can sometimes take half an hour in there trying to get one set of vital signs. Like, it's crazy trying to do a respirate on a toddler that's running around or screaming and a baby that's crying. The other thing is you're always listening with your stethoscope. You're doing your respirate with your stethoscope. So trying to stay there and listen for so long is so much harder than just watching an adult breathe. So that was probably one of the biggest differences I saw. What did you find most challenging? I don't know. I guess what I found most challenging was adapting to kids and adapting to crying babies. I am the type of person that will hold a baby and cuddle a child. The moment it starts screaming, I will hand it back to the parents. I am not the type of person that like tries to proactively help the baby. No, get it away from me. So that was probably the hardest thing, was having kids that are crying that you have to console. Not being able to just pass it off to the mum. Having a mum sitting there trying to talk to the nurse and the baby's crying and you're the one there that's like, I've got to console this baby. So I was like finding all the dummies and I was like shoving it in their mouths, and I had one baby sucking on my finger. Like you put sucrose, which is sugar syrup on your finger and upside down, and it like stimulates their soft palate, and then they start sucking your finger and they think it's a boob. So that was kind of cute. So that was probably the thing I found most challenging. What did I do the majority of the time? So majority of the time you're doing vital signs, discharges and admissions, and you're also doing like teaching the parents and stuff like that. So that's another part of it that you're doing a lot of the time. And doing like pain relief for them and stuff like that. Do you feel you have to take a step back because of the parents? Kind of, but I kind of treated it as if they were like one whole patient. So instead of walking into the room and just approaching the patient and talking to them, I would majority of the time approach the parent, and the parent was my patient. So that's kind of how I dealt with that. Most of the parents are really good. Like if you have to do something, they'll just let you do it. Like they'll literally just give you your child, and be like, do it, like fix them, make them better. So that was good. Like some of the parents obviously were way more concerned and overprotective and stuff like that. So a lot of the time you get them to do the stuff. Like I got parents to help me with vital signs, like simple stuff that it doesn't matter if they do it or I do it. If I teach them how to do it, they're more comfortable. Sometimes the kid's more comfortable. So that's kind of how I dealt with parents and stuff like that. Do you prefer babies or adults now? Honestly, I have no idea. I loved kids. Like I really did love doing pediatrics, but I also really like adults because, I don't know, I just love both. So who knows what I'll end up going into. I definitely wouldn't be mad if I ended up being a pediatric nurse at all. That's all I'm saying. Is peds less manual labour than adults because the patient is not as heavy? Definitely. You pretty much aren't doing any manual labour with the babies. The most you're doing is holding them down or carrying a baby. That's it. So yeah, definitely. Would you say peds is harder than working on a general ward? I would say it's a lot different. Okay, sorry, this has changed again. I'm now filming on my old camera. So the audio might be different and the image quality might be different, so I apologise. So what I was saying is, do I think it's harder? Not particularly. I found that it was a lot different because obviously you're dealing with different sorts of things, but I don't think it was harder because, yeah, I don't know. I don't really know how to answer that question because it wasn't harder, but because there was no schedule and there was no, like, organisation, it was just different. So yeah, that's all I'm going to say for that one. Was it extra sad was the one that I wanted to touch on. It kind of was and kind of wasn't. Like, the idea of the mums not being there and stuff like that was quite sad, and having to see like kids that have had a really tough upbringing, like because we had a few older patients that had rough lives, and seeing them, like making friends with them almost, was so different. It was still really nice though, but yeah, it was a little bit sad. Everything in the nursing field can sometimes be sad, and it's just kind of picking out how you deal with it and how you cope. Alright, so I've just had someone literally just then put a question in. The general question that she's added in was, do nurses in Australia do 12-hour shifts like in the US? We don't, not in Western Australia, not that I know of. I don't know about over East as such. I know that in Western Australia you don't do 12 hours. They've got like a maximum 8-hour shift cut off, so that's all you're allowed to do. But you just work a lot more, so you work probably 5 days a week. So yeah. Anyway, that is all my questions for now. I wanted to say a huge thank you for everyone who sent in questions. I really hope you enjoyed my little paediatric Q&A video. Let me know what you think about paediatric nursing, if you want to try it, if you're excited for it, if this has helped motivate you to want to do it more or anything like that. I really enjoyed it, and if you've got a paediatric placement coming up, you just got to not take it too seriously and just take it as it comes and deal with every day as an individual day. This is going to be like a little series video. I'm going to do my medical surgical Q&A, aged care Q&A, and general practitioner Q&A. So it's going to be like a little thing. So if you enjoy these style videos, make sure you like and subscribe and tick the little notification bell thing, and don't forget to check out my other videos. So thank you very much, and bye. Mwah.